Good morning, everybody. Welcome to this meeting of the single item agenda for the Audit and Performance Committee. And this morning's meeting, we will be going through the annual performance report. Sorry. As I say, it's a single agenda item, but we'd like to welcome you all and note if there are any apologies. There were apologies from Jackie, but thankfully Jackie's here as well. Any other apologies? Okay, we'll move on then. Can I just remind everyone of their obligation to declare any financial or non-financial interests which they may have in any item on this agenda in accordance with Perth and Kinross Integration Joint Board Code of Conduct. Okay, thank you. We'll just move on to the main agenda item, which is, I said, the annual performance report. And am I handing over to you, Chris? I'll hand over to Chris to take us through this. Thank you.
Good morning, everybody. Thanks very much for putting time aside on a rainy Monday morning to come and discuss our annual performance report. This report is presented to the Audit Performance Committee in compliance with the Public Bodies Joint Working Act, which requires us, integration authorities, to publish annual performance reports by the expiration of 4 months of the end of the year in which the report relates. Hence the reason we're here on the 31st of July for a single item agenda. Before we move on to the presentation of the report itself, I'd just like to thank my performance team, in particular, Claire McCarthy, Simon Scott and Luke Goddard in particular for their work on this report. It's been a substantial piece of work which they've all contributed to monthly, so thank you very much to them for that. In presenting the report today, we have taken feedback from the Audit Performance Committee of last year, where there was some high-level feedback in respect of what the committee wanted to see in future reports. So I'll just note 4 of those changes that we've made from the presentation of last year's report to this. So the first one relates to the overall size of the report, so it's reduced substantially from last year, around 30% or thereabout, smaller than it was. It's still a fairly hefty report, as you might expect for an organisation of our size and complexity, but it has been reduced by around a third. We've moved the performance section of the report from the back of the report right up to the front to give it the prominence that the committee felt it was due. We have linked our performance through our strategic delivery plans to the delivery of strategic commissioning plan aims, so there's a much clearer link between the outcomes that are being delivered and that which is set out within the strategic commissioning plan. And within the chapters, we've increased significantly the amount of feedback that we've received from service users, the people who use our services. We'd made a step change in doing that last year, but we've increased that again this year, and that's largely due to things like care opinion that have allowed us to gain a lot more feedback. There's a couple of other points, and then I'll just hand over to the committee for questions. The National Indicators data is published by Public Health Scotland. This means that, and due to data completeness issues across Scotland, it means that you may have noticed some of the indicators, the data relates only to the 31st of December. So it's a calendar year that's used for comparative purposes. And that's, as I say, in relation to completion of data across the whole of Scotland, some places more complete than others. Similarly, the Health and Care Experience Survey is undertaken every 2 years. In the last reporting year is one of the years that it wasn't done, and so we've supplemented that with feedback from our Service User Patient Experience Survey, which covers significantly the same questions. And there's only one other thing to mention, which is in relation to an omission that was brought to our attention just after the date of the publication of the report. And it relates to the scope team and recent IRIS publication. So we'll amend that post committee and make sure that there's a link to that within the main body of the report. And just with that, I'll hand over to you, Beth, for questions. Thank you.
Thanks, Chris. Personally, I think it's a really good report this year. I think it's very colourful, as I pointed out. I think it's quite an easy read, and it's in good sections where you can go to where you want to go if you've got a particular interest. I think I gave some comments. Unfortunately, I gave you not a lot of time before it was published, but in general, I'm happy. But I'm happy to come out now and ask for any questions, points of clarity, comments. Anyone? David.
Thank you. Would it be possible to have a little bit of commentary on all the red bits on table 1, please? Yeah.
Are you looking for that just now, David, or you mean in the report?
I can come back on that to some extent just now. Yep. Yeah, so table 1 provides the committee with an overview of performance against the statutory indicators, the national indicators. So the first thing to describe is the RAG, which tells us that with either meeting or within 3% of the target is green, amber between 3 and 6% away, and red being more than 6% away. So what we can see in terms of comparison to previous years is that there are a number of indicators. If we look at the one in the central columns there, how we compare to 21-22, there's a number of indicators that are in the red zone, and I think what I'm very happy to hand over to colleagues to give some more detail. But what that's effectively telling us is that in respect to those hospital-based indicators, performance has obviously gone down from where it was in previous years. I think the context that we need to bear in mind is that we've moved out of a period where we were still substantially affected by the effects of the COVID pandemic. So if we go back 2 years ago, the services were in a significantly different state in terms of their delivery and also in terms of the demand that was coming to those services. I think what we've experienced after that, and then so moving into just this reporting year, is those services having spooled up again, and in demand having increased substantially, in effect having been pent up during that period of lower demand and different types of service delivery. And I think we're still seeing the effects of that coming through, bearing if we cast our mind back to April, May of last year, we were still in a position with some significant COVID restrictions and the likes in the place. So I think what we're seeing effectively is a wave of demand and activity that's going through the system. So comparisons to previous years are tricky, but it is one of the requirements of the report.
Thank you.
Jackie, would you like to come in?
Thank you very much, Chair. And I think Councillor Illingworth's question is very pertinent, because if we look at the table that you're referring to, which is when you look across it, you see lots of reds in there. And just to echo what Chris has been saying, that the performance for 22-23 has continued to be impacted by the consequences of the COVID-19 pandemic on the needs of our population, as well as our ability to meet the needs. But when we look at the national indicators, with some very few exceptions, you can see that we've continued to perform reasonably well against those. And also in comparison with our peer group. We have today, at the end of July, going into August tomorrow, the benefit of hindsight, looking back at this as a period in time, and knowing from the updates that we've had to the IJB more recently, that we are making inroads into some of those particularly stubborn areas, particularly delayed discharges. So the improvement measures that have been put in place throughout 22-23 and continue to be in place and continue to evolve are beginning to address those areas which have been particularly challenging for the Health and Social Care Partnership. So we know that this is a period in time, but we've got more up-to-date data which will come through in the next quarterly report to you that will show that we're beginning to address those as we ease out of the pandemic. I think one of the things that it would be important for the committee also to note is that when Chris used the word targets, there's the reports that have been coming forward over the last number of years have been comparing ourselves year on year. So as we are revising and refreshing the commissioning plan, which you know is a 5-year plan, and we're midway through that, we're in year 3, and there's work underway to refresh that. Chris and I have been in discussion about bringing forward what we see are actually realistic targets. So what we would be doing is measuring ourselves against what we're saying that we're trying to achieve, rather than just comparing year on year. So that would be something that we would want to add in reports going forward. I hope that would be helpful.
Thank you, Jackie. I think that is helpful. I mean, one of the things that strikes me when I was going through the report is how positive it is. And it's a really nice thing to see such a positive document. But does it give a full sense of the picture is one of the concerns. You know, are we not identifying enough for people the challenges that we have? I mean, looking at the narrative that's in the paper. It tells you kind of the positive things we've been doing to try and ameliorate or, you know, deal with these. But there's nowhere in it that really reflects the challenges that the IJB have got. And that was my only concern and reflection after I'd given my comments about the detail. It's really good to see a positive report, and it is positive and it shows the moving forward. I just wondered if we should be having a little bit of narrative. David's smiling at me, so I'll hand over to him in a minute, just about the reality of how difficult this has been for our staff and the environment to do that. We've talked about COVID, but there's nothing in the annual report really that reflects that in detail that we have. But that's just a thought. I'll hand over. David, you're smiling.
Well, can I start by saying that it's fantastic that for just general comments, that the report has been reduced in size from 91 pages down to 57. It's so much clearer and so much easier to read than previous generations. And for me, it tells a fantastic story of the amazing range of services that are provided by the IJB and the incredible hard work of so many people and so many compassionate, caring people who are really making a difference. But I do agree with Beth that it's really heartwarming to see all the good news stories, but it would be actually pretty useful to have some of the challenges that have been faced by people, because there's lots of, particularly around recruitment and the impact of recruitment. So Kenny wants to intervene.
Sorry, having a few microphone issues. Yeah, I mean, one of the major challenges we are facing, as we have talked about many times, is workforce. And we do mention the issues relating to workforce in the workforce section. Again, we are taking a number of actions to mitigate any risk relating to workforce. But as I think certainly myself and Jackie and Evelyn have mentioned in previous committee meetings, the IGB and this one, you know, it's still a significant issue. And even with these mitigating actions, we still do have real challenges in recruiting to a number of the key professions that we need to meet our objectives as a partnership. And, you know, there is money there. It's not a financial issue, certainly at the moment anyway. We do have underspends in staffing budgets. So that clearly is a major issue. And just in the table that you're referring to start with, most of that is relating to mainly older people being admitted to hospital and then delays in getting out of hospital. So there is still further work to be done. But as Jackie said, you know, certainly that picture is improving at the moment. The key challenge is to make sure it continues to improve over the winter once the hospitals start getting busier. And again, that's tied in with workforce issues and our ongoing various transformation programmes and integration agendas. So yeah, there are a lot of ongoing challenges there. But again, I think the report is reflective. I mean, overall, I think, you know, we're in a good position and things are improving considerably.
Thank you, and I don't think either David or I want to be negative about it. I think it is really good. And I think I just wondered in the introduction, we maybe just at the end put on something about thanking the staff and the challenges that we continue to face, just to reflect that there are challenges. COVID receding into the background has not proved to be the benefit. It has its disadvantages as well. Don't say it like that. I don't mean it like that, but you know what I mean, that everybody tend to think, because we've got to look at our audience. And that's the other thing I was going to clarify. This is our audience, this report's going widely within the community, isn't it? So we want to sort of be, this is a good paper. This is congratulating all the work that we're doing and how well we're trying to combat the problems, but just to have at the front foremost the challenging environment, the challenges of recruiting and keeping quality staff, and thanking everybody for that, I think might be useful. I don't know what you think, Jackie.
No, I'm just nodding in agreement as you're speaking. There's something about the messaging that comes along with this, if it's not in the report itself, and happy to address that as we begin to disseminate it, which is it comes with a great thank you in terms of being able to achieve this, and it's great that you as a committee are recognising the extreme efforts that it takes every member of staff to be able to achieve something like this in the face of the challenges that we've been experiencing. So thank you for that.
The only other thing I would suggest, Jackie, is that we thank the communities as well, because a lot of this we wouldn't be able to do without carers, etc. So if we could just acknowledge that as well, that'd be great. Did Sheila want to come in? I see her faces come up in the camera. Yeah, Sheila, sorry, I can't see you. Welcome, Sheila.
There are a number of people, Beth, with in the chat seeking to ask questions. I'm having some trouble with either my device or connection this morning, so it's not great. But can you hear me okay?
Yes.
Good. Great. So I have a couple of questions, if I may. I agree that the report is very good, and maybe based on your comments there, Beth, perhaps each section's got an improvement journey through. Maybe at the end of that, there's just an extra part to show here are the challenges still to be faced, or what are the next steps. You know, just to acknowledge that it's not like a completed piece of work. Nevertheless, so my questions are around, I have two, if I may, Beth. The first one is around chapter 4, the learning disability section, mental health and learning disability. Learning disability and autism. So my question really is around the scope team, and I think that's a really positive development. But I'm just wondering, what happens when someone comes out of the responsibility of the scope team? Because in my experience, there seems to be a bit of a cliff edge there. So I'm just wondering what follow-up there is if people move away, because some people have complex needs on an ongoing basis, but some people have particular crisis points that might require support from the scope team. So I'm just wondering how we close that circle and make sure there's adequate follow-up, or if people's circumstances change, how do they know to access the scope team? So I'm just a wee bit curious about how that works in practice. And also a follow on to that, and I think Kenny alluded to it earlier, is I know recruitment is an ongoing issue, but in this particular area, and particularly for the scope team, I think it's crucial that social workers working in that area are specialist social workers. And I'm just wondering how recruitment is going into, for example, learning disability specialists or other types of, autism specialists. So that's my sort of first question in that chapter, if I may. Thank you.
Kenny, yeah. I'll hand to Kenny then.
Yeah, I mean, certainly in terms of the scope team, it is set up to deal with people with complex support requirements who have autism and or a learning disability. So the majority of people that are supported by the scope team should continue to be supported by the scope team. But as you say, there will be people whose situation changes, and if they require ongoing support, it will be from one of the generic teams. And again, scope does have limited resources as well, and in many cases it is more appropriate for a person to be supported by the locality team who have a better knowledge of the more generic supports in that person's locality area. Like I say, it's still a fairly new team, and in terms of criteria as well, there's a lot of flexibility there, and we are doing ongoing reviews of how the team operates. I mean, again, if you've got any particular concerns, I'm happy to discuss offline. In terms of recruitment, we certainly have been able to recruit social workers, and we have recently recruited to the team leader post, and that is a person who comes with experience from learning disabilities. We are currently having challenges recruiting to a specialist OT post. But again, we're working with OT colleagues to advertise that post more widely. So in general, recruitment has been fairly slow, but we're pretty much close up to near to having the full recruitment in the team now. Like I say, the big exception is the specialist OT post at the moment.
Okay, that's great. Thank you, Kenny. I think the scope team is a really positive move, and I think that they do a really good job, but I do understand that for some people, their needs change and they fluctuate, and sometimes people get a crisis point in their life where they get a situation where they need the intervention of the scope team, but perhaps not for a lifetime. But so it's just that making sure that it's not just seen as either a one-off support and then they're forgotten about. So it's how we close that loop. But like you said, I'll certainly have a chat with you separately on that, but I think it's a real positive move on that one. And my second question, if I may, Beth, or I can come back to it later.
No, carry on, Sheila.
Okay, thank you. It's in chapter 5 on the community mental health and wellbeing. Again, I think this is a really positive move forward, but I'm just wondering what plans or what's currently taking place about reaching out to community groups who also provide sometimes services to the local community. For example, walking groups and groups where people can meet together for a chat and a coffee. And how do we make sure we're linked into those, and that they know where to signpost people if people come to them? Because as we all know, very often people, particularly in deprived communities, like to go where they live rather than come somewhere else. Thank you.
I mean, we certainly do have the mental health directory, which is continually updated, which does contain a list of all the various community groups, etc., in Perth and Kinross to support people with mental health issues. I don't know if that's quite answering your questions. You're more thinking about groups that are out there and how they link in with the various mental health services.
I think, yeah, Kenny, a lot of really good work. Was it Kenny that answered that? Yeah, I can't see. Was that you, Kenny? Yeah.
Yes, it was.
Yeah. No, there's a lot of organisations out there, like community-based, not-for-profit organisations that do a lot of work in the community, and they very often that's the first port of call for people who are maybe not struggling with their mental health, but maybe where they go to for company, or to access social services, and that where they socially interact with other people. And it's just to make sure that those organisations, particularly in the rural communities, I think it's really important that those organisations know, or at least have access to information they can pass on to people or make visible, so others know where to access them, and also about how we can deliver services where people live, which is the crucial thing, I think, about community wellbeing.
Yeah, I mean, we've got our social prescribers in each of the locality areas, and it is their job to link people to the services in their area that would benefit them, and vice versa. You know, bring the information from the services back. And the bit of work that we are currently undertaking this year is developing our primary care mental health pathway. And that's supporting, looking at supports for people with more mild to moderate mental health issues. And that very much has a community, locality-based focus centred around GP practices as well. And, you know, that will link in a number of services, statutory and voluntary, that we have at the moment, and get them into a more coordinated pathway. So, yeah, your question is very appropriate, and it does happen to an extent, but there is further work to be done in that area, and this new pathway address those issues.
Okay, thanks, Kenny. I mean, yeah, I'll leave it at that, but thank you.
Yeah, I think Jackie's trying to come in. I think it would be on this point, Jackie.
Yes, please. Thank you very much, Chair. I'm just conscious that the IGB will have had an update on the approved community health, mental health and wellbeing strategy led by Christopher Lamont, as you know, as Senior Service Manager for Mental Health. And the steering group for that strategy involves a whole range of organisations providing support in a more targeted way or in a more universal way. And we are picking up discussions with the Ganachie Trust, who are about to hold a symposium, I think it's called, for Perth and Kinross, with a particular focus on mental health and wellbeing, and looking at how they may be able to support, or where are the gaps in terms of the intensive, more acute support that we have, our community-based services that are around. So this is really something that actually transcends everything from community planning right through to our support at the more acute level. So that understanding across that whole spectrum to be able to get this right, to be able to meet needs as they arise is really important. So I think in terms of the bringing forward an update on that when the IJB receives its next day update on the mental health and wellbeing strategy, would probably begin to answer some of your questions at a more strategic level, I think, Sheila.
Yeah, probably. Thank you.
Okay, thank you both for that. I think Martin's next. Martin. Oh, sorry, I'm just, Dave, have you got a comment on this topic?
I've got.
Sorry, Martin, it's just been informed Dave wants to talk about that particular issue. Is that right, Dave?
No, Beth, it goes back to something that you and Jackie were talking about, so I can wait until this conversation is finished.
Great. Okay, thank you. Martin, sorry about that. Go ahead.
Thanks, Chair. I have a comment, then a question. And my comment is, and I get frustrated on these meetings and IJB meetings when people are allowed 2 and 3 questions at a time. And then usually we're running out of time. I've been used in the practice as always that everybody gets 1 question. And I know Sheila said she got hangman, but everybody gets 1 question. And then when it comes to the second question, so that ensures that everybody gets an opportunity. At a recent IJB meeting, I was timed out by the chair while other people had 2 and 3 questions, and I find that frustrating. So I'm just putting my frustration there.
Okay, I'll take your frustrations on board, Martin.
And my comment is...
Yeah, 1 question.
Yeah, my question is on table 1, and we work in percentages. And that's great, but how many is in numbers? And if this is going out to the public, public want to see numbers, no percentages. So it's 58% of what? How many is that? How many have we improved by? 2, 12 or 200? There's no commentary on the decline or the improvement, either in green or red. So we need to have some indication in numbers. Thank you.
I'll hand over to Chris.
Thanks, Chair. Thanks for the question, Martin. In Appendix 2.1, there's an expanded table that provides the actual numbers. Table 1 within the body of the report is a summary. So the actual numbers are provided over the last 5 years in the appendices.
Okay. Happy, Martin?
Well, maybe it's in my defence. It's I'm not seeing that, and it's maybe to do with my computer as opposed to that not being there, or I wouldn't ask that question.
We'll go and have a look and we'll come back to you, Martin. I'll go on to Linda's got a question. Linda,
Okay.
do you want to come in with your question?
I'm going to assume you're talking to me. Linda's my mother. I'm Lindsay. Okay.
Oh, Lindsay, sorry.
It's fine, don't worry about it. I get called Linda quite a lot because she's my mum. So my name's Lindsay Hunter. I'm the staff side representative from the health aspect. I don't think I've spoken really a lot on these meetings, so I just want to say hello to everybody. In regards to the paper that was produced, I think it's a very good one. It gives us some great good news stories we need to work on, especially the workforce, but I would like to highlight we are not the only ones in this position where we can't get staff. And I think there's something good that we can maybe work on, which we are doing through health. Obviously, I wouldn't be able to speak on part of the council, but I think it's something that we need to work in partnership with. I know I've spoken to people on this call about this previously in some development days, that in order to get people here, we need to speak frankly about what infrastructures we have, and that includes the council as well as the NHS. We can say that we are the best place to work, but if we've not got housing, if we've not got schools or anything that are up to scratch, these people will not move to our areas. So it's just to highlight that I'm on board to make Perth and Kinross one of the nicest places to stay, or Tayside, I should say, as staff side in the NHS. But it's just to attract people from the Central Belt, we're going to have to work together. And I know we are doing that, but it's just to highlight that as well. Thanks.
Okay, thanks, Lindsay. Anybody comments to that? Just Chris.
Thanks, Lindsay. Just on making Perth and Kinross the nicest place for people to come, there is a session at the next development session on the Perth and Kinross offer, which the IGB will benefit from. I can't just remember the date for that at the moment. 11th of August. Yeah, so there will be a discussion on the P&K offer at that time, so that will hopefully provide the IGB with some more information.
I think as well, it's probably a good place to highlight that NHS Tayside do have a lot of strategic things that they are looking at right now in order to attract people. And I'm quite sure the council are doing the same. But like I said, I can't speak on behalf of the council because I don't know what they're doing. But I do know that NHS are looking at school leavers, what we can do with apprenticeships and how we can attract people who already live in the area. Because I think the way it looks like in 2032, we're having to employ every school leaver from Tayside, which is just not, we can't do that, do you know what I mean? But how are we going to be able to do it? Because if you look at the demographic with the staff, we have a lot of staff who are over 50. And with the pandemic, a lot of people are tired. So they are looking at options of early retirement or can they retire? So it's trying to get a sort of balance so that we don't fall into the trap that we lose all the experience and then have all new members of staff. So it's just to highlight that NHS Tayside are looking at all that as well.
Thank you, Lindsay. I'll get your name right. At least it's, well, this time it's your Christian name. The last time it was your surname.
You know, it's okay. You're not the only one that gets my name totally wrong. I've had a lot of changes in my life and all good, so it's fine.
Okay, thank you. Dave, do you want to come in now with your question?
Thanks, Beth. It was more a comment, and apologies for delay in getting comment put up. I'm having IT issues this morning. It just goes back to when yourself and Jackie were talking about the recognising issues. I think the report is very easy to read, very well laid out, and you were talking about recognising the issues and an opportunity to comment on the hard work from the staff. Just really a comment to say I think it would be a great opportunity to recognise all the hard work for the staff within the partnership and within the independent and third sector in extremely challenging times that we've had throughout the 2022-23 and ongoing. So it's just really just to say yes, I think that's a great opportunity just to highlight the outstanding work getting done by everybody. Thank you.
Thank you for that, Dave. Yeah, I think Jackie is acknowledging that as well. Martin, do you want to come back for another comment or a second question? Yeah, okay.
I'm okay on
Okay.
that. I'm okay on that. I've found on my phone, I've actually found the tables that we're talking about.
Good stuff.
And what I would actually say that in the summary where it's course is integration indicators, I would put brackets, see table for numbers. Then you're covering all questions. You're actually pointing people towards that because we could understand that, but if you're going into public.
That's a good point. Okay, thank you, Martin. Any other comments? Nope. No questions, comments? Any in the room? Nope. Well, thank you very much, and I'd like you to pass our thanks to the staff that you mentioned, and if we could note that in the minutes, the acknowledgement of the work in putting this document together, and the fact that it's an excellent document and it takes account of all the comments from last year to move on. So it's here for approval by the Audit and Performance Committee. Can I get some acknowledgement of approval of this document? Yeah. Anyone get any objection to the approval? I'll take silence as positive. Okay, this is when I want the gavel. On that basis, we'll approve that. So that brings us to the end of the meeting. Time for me to go shopping. So the date of the next meeting is the 25th of September. Oh, sorry, we mentioned that it was, sorry, the 18th of September. It's my son's birthday, that's why it's stuck in my mind. 18th of September, and I look forward to seeing you then, if not before. So thank you for your attendance.